Hey, Doc. In terms of arthritis, when should I wear a knee brace?
Do you have arthritis in your knee?
Yes.
Okay. When should you wear a knee brace? In general, I'm not a big fan of knee braces. You can wear them, but usually it's for instability. So if you have a torn ligament, there's four main ligaments in the knee. There's the ACL, which is the kind of the mother of all ligaments, provides stability from turning and pivoting. There's the MCL on the inner side. This person's is torn. Lateral collateral ligament, LCL, posterior cruciate ligament. Bottom line is, if you have instability, the knee is too loose, I think a brace is not a bad idea. Physical therapy, strengthening the muscles, sometimes even surgery for like an ACL reconstruction or a torn ligament. There are things called unloader braces. So when people get arthritis, the cartilage on the end of the bone starts to wear down. There's cartilage on the end of the bone. It looks kind of like the white on the end of a chicken bone. It's kind of like the tread on a tire. When that wears down, that's what arthritis is. So you can actually see happens to be that this person here has bone on the inner side of the knee. So there are braces, they're called unloader braces that are kind of spring loaded that unload that area that's narrow. They do help and they do work and they take some of the pressure off. It's just a lot of people don't want to wear a big bulky brace. So in general, if you don't have instability, I don't like people wearing a brace, quote unquote, for arthritis, because the brace is going to make your muscles deactivate. The muscles are going to be like, oh, I don't have to work so hard. And then they get weaker and then you get into a vicious cycle. So if you want to wear a knee sleeve, if you have some swelling, some people like that because the swelling will go down. Other people think it's too tight. So you got to it's kind of hit or miss. But a knee sleeve might keep it a little bit warm too, and some people like that. But the bottom line answer to your question is, if you have arthritis and that's it, you don't really need a knee brace. You really need to get into therapy, get your muscles stronger. Your muscles are your main shock absorber. They're going to absorb more force. The more force they absorb, the less force goes across that damaged joint. So most of the time, you don't have to wear a brace if you have arthritis.
Fantastic. Now I know.